Welcome to Science, Health and Healing. I'm yours truly, Majad Ali. Today's program is about muscles, muscle weakness, muscle pain, muscle injury, muscle inflammation, and then of course muscle symptoms can occur along with injury to bones and ligaments and tendons and joints. And then there are systemic syndromes like fibromyalgia, polymyalgia, erythromyalgia, and there are many other algias. I hope we can cut through all that terminology frivolity and stay with what matters. Then you have to think about things like restless leg syndrome when we talk about the muscles. A quick announcement. Sometimes I feel that the listeners should have a choice in choosing the whole program. So sometimes if you wish me to devote the full hour to a particular subject of your interest, take this number down, please. 973-495-7806. So that is 973. What did I say? 973-495-7806. And just tell them that this is a subject of your choice. And then if you think that you can enhance this program by coming into the studio for 5-10 minutes, please let us know about that too. And then you can say, let us know whether you want a part of the program to be devoted to your calls, question answers. So it will be your program, it will be your choice, it will be your format, you will drive the conversation. And the number again is 973-495-7860. Let's see how this works out. So back to the muscle problems. I should give you a little bit of my background on the subject, so you can put in context what I'm saying and what its relevance might be to your specific muscle problem, or the muscle problem of someone that you deeply care for, you love. The first point that I want to make is that the problem can start as an acute injury. You need a professional to look at this. Whether you think there is associated bone injury, fracture, or there may indeed be injury to nerves. So those are the things which are clearly outside the domain of a radio program like this. I might reiterate here what I've said many times, that the purpose of the radio program is not to treat people. I think that is a disservice. The purpose of the radio program is to do what radio is supposed to do: serve its listeners, serve its community with authentic information. The words which come from the heart. There's no posturing, there's no hidden agenda. The producers relate to you what they learn from in their own fields of inquiry. So if there is acute injury, many times muscle problems actually express themselves the day after. You get involved in a bicycle accident or an automobile accident or a fall. And at that time the body is all warmed up and you don't really recognize the injury to the muscle because there are no symptoms until you wake up next morning. And now it's different. The muscles have been more or less stagnant, and an injured muscle does not breathe the same way that a healthy, awakened muscle does. So this one point. And the other thing from my experience I can tell you is that when we talk about neck problems, and immediately the conversation goes to the bulging disc or the stenosis or the pinched nerves. I was an orthopedic surgeon. I received my certification in general surgery actually, but a big part of my work was an orthopedic surgeon in England, 1968. I also have a prolapsed disc in my lumbar spine, which once it put me in the hospital, and once I was bedridden and was desperately trying to find an orthopedic surgeon or a new surgeon to operate on me. Fortunately, my friends were wise people, and they could tell the demands for surgical intervention from somebody who's in pain but does not need it, and when surgical option indeed, or any other kind of intervention indeed, is necessary. So that's how I escaped surgery. And I'm still, many years later, still grateful to them. I have not lost even 5 minutes of my work time to this prolapsed disc in my lumbar spine in the last 22 years. Nor I have I taken any painkillers for my back problem in all these years. I want to share with you what worked for me. And then you can test it out and see if it works for you also. Stretch, 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 and stretch. And stretch your back before you get out of the bed in the morning. And if you have a problem with the back, start moving your toes, awaken the toes, then awaken the feet, then the ankles, then the leg, then the knees. Because you don't want to start stretching. First of all, it would be very awkward for you to imagine that you're going to stretch your back while you're still in the bed. But in reality, your toes are connected to your back, right? As my toes are connected to my back. My ankles are connected to my back. Everything is connected to everything else in the body, and actually in our elements. So that's the basis of my statement that all practice of medicine which is non-holistic is not scientific. All of it. No exceptions. So when we talk about alternative medicine and complementary medicine, these are insulting words. They actually express the ignorance of the person who is talking about this thing. There's no such nonsense as alternative medicine or complementary medicine or integrative medicine. Sometimes I use these terms myself mainly because I have to reach the listeners who may not be listening to us regularly and may not know us, our background, back to the muscles. Whenever you have problems in the neck or in the back, and let's say you have already seen a professional and you've done the MRI scan, and let's say if the symptoms persist, you have gotten a second opinion. The key element is there compression of nerves which needs attention, because we should not allow the nerve compression to keep injuring the nerve, regardless of what the cause is, whether it's muscle or it's a ligament or it's actually a bone joint in the vertebral column. We use the term subluxated or a little off its normal location. So I think one has to be very careful about the possibility that there is indeed compression of the nerves associated with what seems like a muscle pain or a joint pain or a disc pain. And you need an experienced, real surgeon of the old times. I say old times because when I was brought up in surgery, my mentors, the challenge in surgery was not how to do a neat operation. The challenge in surgery was how to save your patient from surgery. The difference between a wise, authentic surgeon and a mechanic is that a wise, authentic surgeon is always interested in how to prevent that surgery. The proficiency in surgical technique and the craft, that comes later on. If only the society understood this point, there would be a whole lot less suffering and pain. Remember, I speak now here, first as a person who was trained in orthopedics, certified in general surgery, then as a pathologist who looked at a lot of these problems, and then, of course, myself at this time as a subject of pain, as a patient. There is nothing that a person as a patient can do for the bones directly. Nothing. But the health of the bones and the ligaments and the discs and the cartilage between them depends upon something which is entirely under an individual's control, and that's muscles. Over and over and over again, I spend so much time with my patients emphasizing this point. Please focus on where you can make a difference. That's your muscles. People, somehow we have this, I don't know what the really reason is. I'm not a psychologist. I don't really understand psychology. I've tried to read a lot, but I don't understand it. But I don't know what the reason might be that when we are suffering, we don't want to talk about where we can make a difference, which is muscles. We keep talking about where we are helpless. We cannot directly influence the outcome, which is our bones and ligaments and tendons. You cannot reach them directly as a patient. So that's the first point that I want to make, that we ought to be very clear where it is our responsibility. Muscles are our responsibility. Muscle strength, muscle weakness, muscle inflammation, muscle pain, muscle cramps. Those are all areas of our responsibility. In reality, when the muscles get macerated or bruised or contused, the orthopedic surgeon or any other type of surgeon has to really work around this and hope that the muscle's natural ability to heal will heal that muscle. So the concept of muscle modeling is not part of surgical thought or medical thought. The second point that I want to make is, please don't be intimidated by these wonderful words, fibromyalgia and erythromyalgia and every other silly myalgia. Pain is authentic. Your pain is real, and it ought to be respected. There is absolutely categorically no point in devoting your energy and time and just sticking to this. You are shopping for a diagnosis. So, no, I have a fibromyalgia. No, I don't have a fibromyalgia. I think the first time that I saw official recognition of fibromyalgia was, there was an article in the New York Times many years ago. Actually, it was a front page article. Before that, the internist and the rheumatologist say, since at that time fibromyalgia was, the prevalence was higher in females than it was in males, that this is a form of a hysterical. It's like, just think about our ignorance. Think about our insensitivity. Whenever there is something which is more common in female gender, less so now, it used to be dismissed as hysteria. In fact, the word hysteria comes from, the root of the word hysteria is the same as the root of the word hysterectomy, removal of the uterus. Fortunately, we are moving away from that. We don't believe in that nonsense, and fortunately, we don't need to be intimidated by those people who want to do that. But what did this New York Times say? It said that FDA has approved this drug Lyrica, and so fibromyalgia is an authentic disease. I got interested in this field back in early 1980s. And I published the first paper on this subject of chronic fatigue fibromyalgia in the Journal of College of Advancement in Medicine. And before that, there was no concept that chronic fatigue or fibromyalgia have anything to do with oxygen or acidity. It was one of those mystical diseases. And so rheumatologists and internists would say, well, this is hysteria. There's no objective evidence for any disease. And as I remember, one doctor said, the frustration is there is nothing there that I can treat. Of course, his concept is that unless you have a drug to treat anything, that suffering, that pattern of suffering is not authentic. But New York Times did us a great favor, the great service that New York Times renders. My comments about the New York Times, whenever I make them, they are restricted to the field of medicine and healing. I have no expertise in matters of finance or politics or anything else. But in New York Times, in medicine, distinguishes itself in propagating ignorance. Having propagated the ignorance of cholesterol for 50 years, it has never publicly apologized for all the misinformation and the damage it has done. And God forbid if it ever talks about insulin. There's a new study which says that the so-called HDL, good cholesterol, is not good anyway, after all. I think I'm going to write, and I'll put something, the citation for this. So when people have a lot of good cholesterol, they have a much higher incidence of heart attack. It's just as absurd as everything else about cholesterol. I don't know why we waste so much time on it. Remember, the New York Times was telling you that eggs are bad because they have cholesterol. So we should not really let these diagnostic terms deepen our suffering. It's an insult to our intelligence as doctors. It's an insult to your intelligence as a patient, and it perpetuates your suffering. The muscles cannot breathe. Muscles do not write computer programs. Muscles do not write music. A muscle can cramp up. It can become oxygen depleted. It can be loaded with acids, and so it becomes sore and it hurts and it becomes weak. But the muscle physiology is so absurdly simple. If it breathes its own air, it can burn the acids and the waste. It can get the lymphatic flow out of it. It can invite new, fresh, oxygenated blood to come in. It can maintain its energy. And if it does get overused or bruised up or contused, it can heal very fast. And the other thing that I should say, we should never talk about muscles or think about muscles without talking and thinking about the essential connectivity of muscles through the brain with the rest of the body. So now what do we do? Well, you do need a professional just to separate what might be. It's not the muscle injury I'm so much concerned about. It's what the muscle injury might mask. There may be an underlying injury, and the pain of the muscle distracts you from seeking help for the underlying injury. So that's always important. But once you have been told that your pain is coming from muscles, and it's because the muscles are being pinched or the nerves are being pinched, I think that I would, after you see a professional, if the pain persists beyond a reasonable period of time, and there's uncertainty about diagnosis, I think I would get a second opinion, specifically on the issue that is there a valid reason to consider a procedure or a surgical intervention of any kind. Because if you get now from a second opinion and I assume that they are competent people who are giving you advice, then please understand that the muscle problems are in your province, not in the province of your doctors. You can learn it the hard way or you can learn it the easy way. The easiest thing that I would do is stretch, and stretch muscles. And never stretch it to a degree that they cause discomfort. No pain, no gain does not apply here. Huffing and puffing exercise does not belong here. Anything which causes injury to the pain, you do not want this. I will tell you, you can do as much exercise as you want in the non-huffing and non-puffing mode, that as much as you want to. Just take breaks. Just look around. There are a lot of always. There are children, beautiful children to look at. There are birds. There are clouds. You can listen to people, listen to music. You can do so many things. So the first thing I would do is stretch. And the dogma there is, thou shalt not cause discomfort to yourself under the mistaken belief that you're going to stretch these muscles and speed up the healing. I know. I am aware that there are people who think differently, but fortunately I don't have to pay any attention to them. I would rather be clearly wrong, because if I'm clearly wrong, you see, you can be wrong, or you can be clearly wrong, or you can vacillate between being right or being wrong. Vacillation stage is awful. It will never give you clear thinking and the courage to do what needs to be done. So if you are clearly wrong, something might happen and it will set you right. So I would rather be clearly wrong than constantly vacillate. So after stretching, what would I do? I guess most of you would have guessed that this guy is going to come to his castor oil, because he doesn't know how to give a program on pain, especially on muscles and the ligaments and the joints, without bringing castor oil, topical castor oil. I have no comments. I actually do not recommend castor oil to be consumed, to be swallowed. I'm not going to make any negative comments about this, only that in this context that I'm talking about, it's the topical castor oil that I'm asking for. Now, acute illness, actually, arnica is very good. And arnica you can get in a cream form. And I can't tell you the brands. But you know, if you go to a health food store, and all your life you have made your judgments in life by listening to that inner voice, which is based on your experience, your own sense of things. So rather than read and get all the claims of what this does, this brand does, that brand, pay attention to or seek the counsel of the man behind the counter. Generally, my experience is they're very good. And they will tell you, because they are not robots. You know, when they sell you, let's say, one brand of arnica, and they have 3 brands, most of them are going to be curious, what do we get in feedback? And so generally they know which brand is better than other brands. And then you can make a value judgment whether the man behind the counter is believable by your standards, or he is just promoting a particular product. And that's again your responsibility. But I think arnica cream in acute or subacute injury is very good. It should be one of the top priorities. Now, topical magnesium is very good. Magnesium is in many ways the guardian angel of muscles. Whether it's a heart muscle, it's a muscle in the coronary artery, it's a muscle in the stomach, it's a muscle in the colon. Magnesium is wonderful. You need a little bit of a calcium with it. And I always like to give potassium along with magnesium. So one of my favorite prescription that I use is the magnesium, potassium, and taurine. Taurine is one of the best things for the nerve muscle conduction protection. Remember, muscles can only talk to each other through these neurotransmitters. Well, I know somebody will jump at it and say, oh, come on, Dr. Ali, that's not true. Muscles only talk to the nerves through neurotransmitters. Okay, so I misspoke and you corrected me. Thank you. Strictly speaking, the definition of a neurotransmitter is a substance which allows a nerve cell to communicate with another nerve cell, or a nerve cell to communicate with a muscle. So topical things that come to my mind would be arnica, castor oil, and liquid magnesium. Now, these three things that I mentioned, I started the program by talking about muscle weakness, muscle soreness, muscle cramps, muscle inflammation. So actually, with all those conditions, assuming that you have seen a clinician who has separated if there is a need for intervention, medical intervention, beyond what you're going to do yourself, the only authentic muscle doctor that you can have is under your skin. Please understand this once for all. The only authentic muscle specialist that you have is the person under your skin. I was saying that I don't know what might be the reason why we like to talk about bones and the discs and the vertebra, but not the muscles. I think because in muscles we have this ugly reality of facing our own responsibility, because we alone can make a difference in the muscles, while it's very easy to transfer the responsibility over to a doctor once we say, well, one of the vertebrae is out of place, or the disc is bulging, or the disc has collapsed. I'm not trying to belittle the suffering caused by those problems. I'm only trying to make a distinction between what is our responsibility as individuals, because we own those muscles, and where we need help from other people. And I'll tell you one other thing. There's only one person who can precisely tell you where the muscles need the help, whether it is stretching, or it is acupressure, or it might be acupuncture in the hands of a good acupuncturist. I think the best physiotherapist is yourself. I know that I am inviting criticism from some people. What do you mean that they are better physiotherapists than me? I'm trained and I have degrees and have certification. Sir, I used to conduct a manipulation clinic in England, 1965-1966. In that clinic, I manipulated an awful lot of people. So I speak from my experience. It's not that I'm ideologically driven. It's not that I have this need to put anyone down. But when I come to WBAI, I have only one purpose in my mind: to be useful to WBAI community to the best of my ability. So I will tell you that the only physiotherapist which can tell you which particular group of muscles in your body need attention is you. Oh, they talk about there is a psoas muscle syndrome and there's a deltoid muscle syndrome, and they talk about it. But there are billions and billions of muscle cells. Only you can see at what particular posture, at what particular degree of motion, in what particular joint elicits that voice from the muscle which tells you, hey, you're pushing me, back off. No one else can do that. I do have very, very strong opinion about that type of a physiotherapy which hurts the patient. Fortunately, more and more physiotherapists and chiropractors are becoming aware of that. I have actually heard those professionals saying, oh, no, you really have to crack the bones. Remember that expression? Oh, no, I had to crack those bones. Okay, sir, you go ahead and crack those bones. I can only pray for your patients if your purpose is to crack the bones to heal them. And so I say that gently move and stretch yourself in every possible direction to find out which is that particular angle, which is that particular position of the limb or part of the body, which is the particular location of those muscle fibers which are under stress. And if you are really kind to yourself, if you are gentle to yourself, you can of course do a little bit of trigger point search yourself. Just with your thumb, start very slowly, and where the area of the pain, just explore it. And when you hit a trigger point, those injured connective tissue cells and the muscle cells will tell you, hey, back off. You're hurting us too much. And you know the answer. Hydrogen peroxide is very good for this purpose. But I think the first thing I would say would be that if you have available to you liquid magnesium, some people call it oil of magnesium, whatever you want to call it, but it is a magnesium in a liquid form. And you apply it. You can apply it liberally, because I have never heard of topical magnesium causing problems for anybody. You can't overdose yourself on magnesium. Well, the word, if you did, you will just have loose bowel movements, which is not all that bad. But I've never actually encountered that. So I'm not concerned about overdosing with liquid magnesium. And usually it will dry up in some minutes. And then as a second step, you can either put arnica cream, arnica lotion, or you can put castor oil. Now, castor oil has the longest tradition in the Chinese culture. Mustard oil has been used most frequently in Pakistan, where I come from, and many people in India, historically, traditionally, they've been using sesame oil, but I think my personal experience is nothing comes close to castor oil. And if you have a background in chemistry, I might tell you that castor oil, to my knowledge, is the only oil which has this radical called hydroxyl radical. And other people have also thought, and I have thought about this, maybe what it does is it raises the level of energy of castor oil over other oils. And that is why I see better results with castor oil. So we covered arnica, we covered castor oil, and I've talked about magnesium. And I also told you that those, if you're going to have 500-700 milligrams of magnesium, if you can get magnesium aspartate, that's very good. But if you can't get that, ordinary magnesium oxide is okay. The only thing that I think I would, there are very few things that I think all people ought to be aware of when they have a blood test in a doctor's offices, the routine blood test chemistry. The number one thing for me would be creatinine, creatinine. Because it is so disturbing to see somebody's creatinine level, normal should be, let's say, 1.1. It was climbing up 1.8, 1.9, 2.2 to 3.1, and at that time the doctor says, well, I think you have to see a nephrologist, and then when it goes to 4 or 5, then there is a talk of dialysis. Hard to believe how many patients I have seen. When I see their creatinine 4 or 5, sometimes actually I ask them, did your doctor, do you know that you have a serious problem with the kidney? He says, no. It's hard for me to believe that these people who've been having rising creatinine for a long time, and they're not even aware. Because somehow there is this malignant perception, even among nephrologists, that kidney disease is not reversible. And so as far as they're concerned, they're going to watch the creatinine rise from 1.5 to 2.5 to 3.5 to 4.5 to 5.5, and then the nephrologist will say, wearing a stethoscope and a white coat, that you need to be prepared for dialysis. So you ask yourself, how long has this been happening? It's very much like diabetes. They will not do the right test, insulin test. They will keep telling you that blessed A1C test is negative, so you don't have to worry about diabetes or the fasting glucose, until such time one day where you have diabetes and here's a prescription for metformin. There are a lot of things that we have to assume responsibility. Neither Obama's Obamacare, nor President Trump's Trumpcare. You don't even, I have spoken about this before, but our major paper about insulin, I got 6 rejections from American journals. And I thought all this wonderful body of data that me and my colleagues have been collecting for years, we'll take it to our grave. The system is so powerful. And finally, I published it in THANX. That's an integrative journal, and so the mainstream diabetologists, endocrinologists, they are not going to look at that. Except all those diabetologists and endocrinologists and internists, they dare not defy the journal Nature, because they know enough to know that Nature is where the real science is published, and medical journals are not journals of science. I have never had a professor any place in medical school, any place in the world, who would dare belittle Nature. So fortunately, Nature allowed me. Now I think I have put in 9 commentaries that I published, publication. I think there are 9 pieces that they have accepted so far and published on the subject of. But coming back to the muscle pain, by the way, I might tell you that if you are insulin toxic, you will also have muscle weakness, and many times you will have the numbness and the tingling. The commonest cause of numbness and tingling, in my experience here in New York, is insulin toxicity, and insulin is pro-inflammatory. So if you have any muscle inflammation, if you are insulin toxic, it's going to be much harder. I'm not going to say that you can never clear muscle inflammation, but most people know, fortunately, that when you are injured, you should go sugar-free. When you are injured, love healthy fats. When you have a chronic disease of any kind, other than, even when you have a kidney failure, and creatinine is, I spent a few minutes on creatinine, basically because I want to know that when I look at the lab chemistries of anyone, the very first thing I look for is a creatinine. Then I would look for hemoglobin. Then I would look for immune cell. And there are a lot of those numbers which are not real tests. Computer just multiplies and divides and clutters up the report. And how profoundly ironic that the test that you really, the patient needs is creatinine more than anything else. The doctors spend all their time on this blessed good cholesterol and bad cholesterol, and the ratio of the cholesterol and what the patient needs completely gets ignored. So if you are listening to WBAI and you don't know my background, and you're saying this guy is really seething with anger, and he's trashing everything. So, ma'am, sir, I directed a laboratory at Holy Name Medical Center in Teaneck, New Jersey for about 24 years, close to 25 years. And during that time, we did more than 125 million tests. So I know something about lab tests. And if I'm talking about belittling this whole focus on cholesterol. By the way, even the Journal of American Medical Association now says it has officially retracted, editorially retracted, everything that has been writing about cholesterol for a long time. Let's get back to the muscles. So, I was talking about the peroxide packs. I think that they are really very good. You can take 1 part of peroxide, 3% that you get from the drugstore. This is very inexpensive therapy. All the things that I'm talking about, they are either free or they are very inexpensive therapies. You just need the effort to get the diagnosis made from someone. And the diagnosis that you are interested, or I'm interested, is that there is no need to consider a surgical intervention. That's all what I want to know. I don't need to know anything from them, anything else. Well, when you do those tests, they are going to tell you that there is no tumor, there's no cancer. That is an important question, but that in clinically, it's really not an important issue because the answer is right away there in the report. But just for the sake of completeness, yes, tumors in the muscles, usually they are benign, they are called myomas, just like you have fibroids in the uterus. Uncommonly, they are cancerous, rhabdomyosarcoma, for example. Now, rhabdomyolysis is a term which is being used more and more, which means dissolution of muscle cells. And since I was talking about cholesterol, more people have died from rhabdomyolysis because of the use of cholesterol statin drugs, to my knowledge, than any other drug. It's not a common problem, but when it happens, it can cause shutdown of the kidneys, and in spite of best effort, some people lose their lives. So, but that, strictly speaking, is an acute illness, and usually there is a lot of other stuff which is going on. So that would not be in the province of this conversation about muscles. And as I look back, I really don't remember ever that there was a patient with rhabdomyolysis where there was a diagnostic uncertainty. These muscle enzymes, they are called CPK enzymes. They go sky high. And the other enzymes is LDH, and that also goes sky high. So even though it may seem strange that in a discussion of muscle weakness and muscle soreness and muscle pain and myalgia, I would bring in the term rhabdomyolysis. But that diagnosis is straightforward. In your chemistry report, there is this LDH enzyme, and you can tell. And of course, in most cases where it's dangerous, their liver enzymes go up. So that's a clinical setting, and I shouldn't really spend more time on it. Let's say what else we can do. I talked about magnesium, potassium, taurine, and that's where I went over to creatinine, because that is such an important thing that you cannot overstate your case. And you know there are dialysis centers sprouting up every third block. So in that context, creatinine is important. And creatinine is important when I talk about magnesium and potassium and taurine, because I would not want to give a lot of potassium to people who are on the way to dialysis, because their potassium is high. And the potassium result is always part of the lab report, which will give you the information about creatinine. The way I remember it, always includes the potassium result. So you can just look at the potassium. If the potassium value is in the normal range, let's say it's around 4, 4.5, something like that, you don't have to worry about that. And then I said that magnesium, you really can't overdose yourself. You will have some loose bowel movements, which is not all that bad. And then you learn something. I can take so much magnesium. Maybe you can take 750 milligrams. And potassium should be much less, perhaps 150. And taurine, you can go up to 500, 750. People who have memory problems, taurine is very good. People who have neurologic problems, taurine is very good. So this combination, magnesium, potassium, taurine, I almost prescribe it for every single patient. But I take a quick look at the creatinine value, so I am not hindered in any way. So now what else can we do? This question of trigger acupressure, which means that you explore where the pain is, and with the thumb, with the direct pressure, you try to localize. And once you have found a pressure trigger point, then you just, with a rotary movement, with incremental pressure, in the beginning, actually you should do that sometimes. You'll find it interesting. That when you touch a trigger point, it's actually quite tender. But if you keep very gently, keep increasing the pressure, you will see that in 4 or 5 minutes, you have squeezed out the stagnant acids, the lymph from there. And then if you apply the same pressure, it doesn't hurt so much. And sometimes it doesn't hurt at all. You have not healed the trigger point completely, but you've established the diagnosis, and you've learned something more important. That this simple idea of my playing a doctor helps me clear up the pain, and it may take a few days to clear it up completely. Whenever you think about chronic pain, this fibromyalgia, there is a problem of mood memory mentation. And that's just because the problem starts with muscles not being able to breathe their own air and get rid of their own waste acids. That problem now goes over to the brain. And so you have problems of mood memory and mentation. But the basic principle is the same. When I first published this paper, I think it was 1985 or 86. At that time, that was the first paper trying to explain the molecular basis of fibromyalgia. and chronic fatigue syndrome. And sometimes I read it, and it is as if that whatever was published 32 years ago by somebody is of no interest, and all kinds of wonderful theories. And you must have seen that television commercial for Lyrica. Oh, it's a hyperactive nerves, so take Lyrica. Or my doctor gave me a Lyrica. He was a great doctor. Okay, good for you. Your doctor is a great doctor who told you that fibromyalgia is because of overactive nerves, and here is a Lyrica drug, and that would relieve you. Actually, I personally not seen people who benefited a great deal from Lyrica or Lyrica-like drugs. Some people do get some temporary benefits, but Lyrica is not addressing the underlying problem. The question that Lyrica should bring to our minds is, what makes those nerves hyperactive? So if the nerves are on fire, shouldn't we find out what are the fires which are putting the nerves on fire and try to put them out? Well, those fires are in the colon and the liver. And yes, the fermentation in the mind, fear, anger, frustration, not knowing the answer. And people will often say, well, you know, the information is very contradictory. No, it's not contradictory. If people would only try to figure out what's the background of this person, we should use our common sense. We should not focus so much on the technology and the techniques and the great advances that practitioners are trying to impress us with. We should just listen to them. Does it seem like an authentic person? Okay. Is his real focus on promoting and marketing this particular technology? Or is in his words there is some sense that he feels your pain? He's thought about it. He's reflected on it. I don't hold anyone for not writing papers. Not everybody can write papers. But why is it that all these big professors who can write, they turn paper after paper after paper about drugs? Why can't they turn paper after paper, or at least one paper on just fibromyalgia, and try to find out the natural stuff which works? Well, draining the swamp, to borrow an expression from Trump, our president. There is a medical swamp too, which probably needs to be drained just as sorely as the political swamp that needs to be drained someplace else. I shouldn't really be distracted by that. Let me see whatever I should tell you about these things. Oh yeah, probiotics. So whenever you have persistent pain, think about the liver and think about the gut. So if the muscles are not healing and the muscle weakness or the muscle pain or the muscle inflammation persists, then the answer is going to be in the gut or in the liver, and usually in both. So since I have already told you castor oil topical is great for muscle pain, it happens that it would be one of the top therapies for liver, anybody who has chronic muscle pain. Castor oil on the liver, which is located on the right side under the ribs. Actually, for women, this is very good, because if you're going to apply a little bit of an oil on the right chest wall, you might put a little bit on the breast, and then why ignore the left breast? Castor oil, a lot of women will tell you that castor oil topical, just a little bit. And while I'm on the subject, women are very concerned, and men also are concerned about hair loss. And there, just dabbing a little castor oil, separate your hair and put it right on the scalp. You can tell I have attention deficit, right? But the two other things that I think we should do for hair loss is this strong probiotic. And then kefir clearly is better, head and shoulder above yogurt. And we never buy fat-free yogurt. Why would I want to? I want healthy fats. Why would I want to do a dumb thing like buying fat-free yogurt or low-fat yogurt? So, and most of the time when you are preferring kefir comes out, well, it tastes like thin yogurt, and you can put some more water. And I think the taste is great. So then you can get into the habit of, to the degree that you can, replacing yogurt altogether with kefir. Kefir, the difference is that the culture which is used to prepare kefir, that includes different species of probiotics than for yogurt. And the benefits, especially the liver protective or liver healing benefits of kefir, largely accrue from the use of the culture that you do for it. So that's good. But I think there are a lot of herbs which are very good for probiotics, for the gut, I should say. There are some products, I can't name the products here really for you, but if you ask them, even the ordinary drugstore, you can ask them, they might be able to tell you. The baker's yeast is available as a supplement, and now this is a different approach that is strictly not probiotic. But what it does is you're putting in healthy yeast to compete with bad yeast, which produce the acidity which causes the liver, the stomach, the muscle weakness and the muscle inflammation and myalgias of various kinds. But the message from me here is that please think gut, please think gut, please think gut, please think liver, please think liver, please think liver. And, if you keep thinking about the disc, the scan, etc., there's nothing you can do except to just get worse than your aggravation. You can tell I find it hard to even find the right words on some subjects. I've noticed that on some subjects it's difficult for me. Sean is looking at me. On some subjects I can't. I know it's a good idea for radio hosts to be always cool and calm and collected and, project a certain level of equanimity and inner calm. But then when I come to certain subjects, I feel that there is some voice from within me, and I can't be a good radio host. Okay, but that's life. Okay. What else can I tell you about myositis, whether it's a viral or yeast or parasitic or bacterial? That just is part of that. Bacterial myositis is very, very uncommon, but that's where you wouldn't need antibiotics. Parasitic myositis, again, is uncommon in terms of a localized pain. Yeast myositis is actually a chemical problem. The yeast produces the toxins which cause the inflammation in the muscle back to square one, which is restore the bowel ecology and detoxify the liver. The viruses, there is no direct treatment. The very best treatment for viral myositis is actually peroxide soaks. But then if you're going to do peroxide packs or peroxide soaks, then why not apply liquid magnesium, and also consider the arnica preparation. Restless leg syndrome, please get rid of this thing in your mind. Your legs are restless because they are loaded with acid. Your legs are restless because they can't breathe their own air. Your legs are restless because your day is not good. And so why would the muscles become so kind? If the muscles are very angry and annoyed during the daytime, why would they just become your friends at night time? If they're annoyed by you during the day, they are certainly going to be annoyed by you during the sleep. Okay. I think for one day I have I've done quite a bit. I've been good to English language. Let's put it this way. Just for one day, this is enough. In 1 hour, I've been so kind to English language. English people really, the English teachers should realize that it's foreigners like me and the Chinese from Hong Kong who are really keeping the English language alive. Because all the dons in Oxford and Cambridge and University of London and all these great scholars, the literary figures, I don't think they are adding anything to the English language. I mean, what did Jane Austen do for English language? Or what did Shakespeare do for English language in the last 300 years? Okay, he did when in his own time, but not recently. So recently, I think it's people like me who keep coming up with new terms, and they amuse. I do actually get amused when suddenly an absurd word comes out of my lips. I hope this has been useful to you. Again, let me give you the number, 973-495-7806. This is the number that you will call if you want a radio program topic of your choice. If there's something you want me to discuss for the whole hour, and if you think that you have to contribute for 5-10 minutes, you want to come into the studio, the number is 973-495-7806. 7806. This has been Science and Health and Healing. I'm your host, Majad Ali. Until we meet again, may you be gracious, graceful, and generous in your spirit. Good day.